mentioned I'm 70, and let's say because of your company 5 years from now, what's going to change in my world or somebody like me? What's going to be the one thing because of what you're doing that wouldn't have been true back in 2024 if we're talking about 2029?
I think for what you're going to see 5 years from now is really us focusing on a shift from reactive to proactive care. So, really, how do we predict that there is a change in your behavior prior to this leading to a major medical event? So, we want to use continuous and autonomous monitoring without invasive tools like cameras. So, really being able to use a wearable to be able to follow patterns, create your own kind of norm, your baseline, and when your behaviors fall outside of that, whether it is your number of bathroom visits, whether it is your sleep patterns, your activity patterns, when they fall out of your baseline, we want to be able to flag somebody to say there is a change here. And let's look at this change because it's a minor change right now before it becomes a major medical event. So much of money right now is being spent kind of on that kind of after the event has happened, but how do we prevent that event from happening? We're going to use, like I said, continuous and autonomous monitoring to make sure that those things are caught as early as possible.
So my three-part question is, what are you doing within your very innovative spaces to put trust in, and trust being as important to technology? Who's going to pay for what you're doing, and where do those where do those benefits accrue? And how can you make sure that the new technologies aren't just helping, Steve Klasko in Miami, but helping, Mrs. Jones in North Philadelphia that might not have access to or a Ring and Apple Watch and the technologies that you're doing?
Yeah, so as a company that's focused on older adults, we see that 50 to 60% of total healthcare is spent on individuals over 65 years old. And most of that money is kind of funneled into clinical care. And so what we're really trying to do is to shift that to where we really are focusing on that reactive, not that focusing on the proactive, not that reactive model. So we're in conversations with Medicare Advantage and value-based care companies to ensure that our benefits are shared equitably, but also our primary customer is going to be those senior living communities or in-home health companies. And so whether that's a for-profit or not for-profit, what we are doing is we are going to create the ability to be a force multiplier when it comes to caregivers. And so as Ryan mentioned earlier, there is a very big shortage of caregivers, and that's only going to get bigger as our baby boomers continue to age. And so I think by 2030, all baby boomers will be above the age of 65. So we really need to have these force multipliers. And so what CarePredict is able to do is we are able to really help a community or in-home or a caregiver understand when there's a change in that person's behaviors, which is an indication of some other health issue. And so by doing that, we're able to have our caregivers work more efficiently, as well as our nurses really be able to say, who do I need to talk to or work with today to because there is a change in condition that may be leading to something bigger. So through CarePredict, we've been able to reduce hospitalizations by 39%, reduce falls by 69%, and increase length of stay in senior living communities by 67%. All while doing this, we're improving our staff response time to the needs of our residents by 37%. So what we're really trying to do is like, invest this money early as a senior living company or in-home health, get more out of the team that you already have in place, which is going to be harder and harder to find as we have a shortage of caregivers. And so that's what our products are going to do. The trust comes when a caregivers see that the predictive analytics that we provide with them match up with the qualitative metrics that they're seeing. So I'm noticing there's a change with this individual. However, also the AI powered care predict is also noticing this. Those two things align. Now I've built trust in this product, and so the next time when maybe I didn't see those changes, but the predictive analytics of care predict tell you there's a change, now I have that trust because in the past those two kind of metrics have aligned.
It's hit me coming over from the traditional healthcare ecosystem to General Catalyst that the humans that are involved in your team are incredibly important. And all of you have curated, because it's all your money, who you have on your team. So in 3 to 5 words, If you could just say, what defines the culture of your team that really makes it unique, that will get somebody to want to invest in you?
Diverse, passionate, and mission driven because it's personal.